Hey everyone, Nigel here again from Phoenix Rehab, Physio in hand, and today I want to talk to you about shoulder pain, specifically rotator cuff injuries and pain, right? So many patients don't realize that their shoulder pain could be a rotator cuff partial tear. Many also have no idea until one day when they wake up and they cannot lift up their hand above their shoulder, and there's a lot of sharp pain. So here's the problem, right? So most people feel their rotator cuff pain typically starts off at night. You know, feel a bit of ache, feel a bit of pain. For the bit more advanced rotator cuff pain patients, what happens is that they may roll around in bed and they accidentally roll onto that shoulder that has the rotator cuff partial tear, maybe 2 o'clock, 3 o'clock in the morning, and there's a sharp jolt of pain, and that pain wakes them up. Or maybe you may be reaching to the back of your shirt, you're tucking your shirt at the back, or for the ladies, they're trying to fasten or unfasten their undergarment, and then you feel a very sharp catch in your shoulder, right? Or maybe, right, you are trying to lift something overhead at work and trying to bring it down or push it up, and then your arm just gives out. There's a sharp pain, and then it just becomes unstable, and you just drop whatever you're trying to do. And here's what most patients do, right? They tell themselves this in their head. They say, oh, it's okay, it's just tight, maybe just a strain, you got to rest, and you got to keep waiting for it to settle down. With rotator cuff tears or partial tears, this one doesn't settle, unfortunately. Okay, is it a myth or a mistake? Let's talk about it, right? And here's what's actually happening. A partial rotator cuff tear, okay, is a ligamental tear. It does not heal itself if you keep loading your shoulder the wrong way. Every time you try to push through the pain, just push, lift it up, push, or go to the back. Every time you push through your shoulder pain, you may be making your rotator cuff tear bigger. It's like you are re-tearing the tear again and again and again. From a partial tear, it can actually degrade if you keep tearing it accidentally, right? Because you're trying to make it better, but it's not the right way. So a partial tear can become a full thickness tear. And the difference between a partial tear and a full thickness tear, a partial tear may be able to recover with just shoulder physio, but a full thickness complete rotator cuff tear almost always need surgery, okay, to fix the tear, then followed by shoulder physio. Okay, that's the first mistake, right? They just push through it. And then the other mistake with rotator cuff tears that a lot of patients do, unfortunately because they don't know better, right? The other mistake is actually stretching. Most patients with shoulder pain, they tend to start stretching their shoulder or their painful shoulder very aggressively or more than usual, right? But particularly for rotator cuff, that's wrong, not right lah. Because there's already a tear, the shoulder is already partially stable, it's unstable. Stretching it the wrong way or stretching it too much may loosen, may tear it even more, right? So what your shoulder really needs is actually a specific controlled loading under physio care or physio assessment. Okay, what that means is that you got to strengthen the right shoulder muscles in the right sequence. It's not something that you can do generically or with stretching or with YouTube or with social media. You got to see our shoulder physio, do a proper assessment first. They find out what's missing, what's wrong, and then we can work based on that. So our physios at Phoenix Rehab assess rotator cuff almost every week, right? So they will tell you exactly what kind of tear that you're dealing with. Is it a partial tear? Is it a small partial tear? Is it a bigger partial tear? Of course, imaging is the best, most clear, but we can go based on clinical palpation, right? Or whether conservative shoulder physio is the right path, is it good enough? Or whether you need to do the shoulder surgery with the shoulder surgeon, right? And what the recovery timeline looks like for your shoulder rotator cuff injury, right? So you got to come in for an assessment, really. You cannot just wait for it to settle, especially if it's more than 7-10 days and the pain is not improving. Come in really, don't wait anymore already, because it's just If it's not improving after 7-10 days, it's likely going to be something that you've got to be treated. It cannot heal on its own. So if your shoulder has been bothering you for more than 7 days, 10 days, please don't wait anymore, okay? WhatsApp us, WhatsApp me, drop a comment down below, or you head to our website, phoenixrehab.com. Get the right answer to your shoulder pain, shoulder stretching pain, or instability early. Okay, your future shoulder, your ability to play, use your shoulders in your sports, on your life, in your work, really depends on it. And that's all I have for you today. You take care. Bye.